My name is Georgia Roark. I am a 4th semester nursing student. Today is April 15th, 2019, and it is about 1:10 in the afternoon. And today I'm going to be inserting a NG tube. So beforehand, I want to make sure I have an order to place the tube as well as what size it needs to be. So I have a 12 French here because that was what was ordered. And then I want to assess to see if my patients had any recent nasal surgery and for allergies. So let's get started. Hi, Mr. Jones. My name is Georgia. I'm going to be your nursing student today. How are you doing? Good. I closed the curtain and provided for privacy when I walked in the room. Can you tell me your name and date of birth? Perfect. And do you have any allergies, Mr. Jones? No? Perfect. I'm going to go ahead and raise him up to a good working height for me. And have him up in the high Fowler's position. Mr. Jones, is that okay for you? All right, so I'd explain what we're doing and why we're doing it to the patient, just so he knows what's going on. And then I'm going to go ahead and assess my patient here. Okay, so like I said before, I want to assess, see if he's had any recent nasal surgeries. I want to check the nose, both sides for deviated septum. I also want to occlude each nair and see if he can breathe out the other one. Make sure that it's going to be okay. And then I'm going to check his gag reflexes as well as his mental status and if he's going to cooperate with us, which he is, so that's good. I'm going to go ahead and get some stuff ready. So I'm going to get my pH strip ready, as well as my tape. I'm going to need 4 pieces. And a long piece, of course, for my nose. I'm going to tear this one down halfway. This is for securing the tube on the nose whenever I need to. Okay. So I'm going to go ahead and get everything set up. And give him a towel across his chest. And I'm going to go ahead and get my tube ready. Okay. And then I'm going to go ahead and measure how far the tube's going to need to go in. So I measure from the tip of the nose to the ear. So about 12. And then from the ear down to the xiphoid process. So feel for that, about right there. The tip of the xiphoid process is going to be about 47, it looks like I'm at. So I'm going to go ahead and I'm going to mark that with one of my pieces of tape here. Okay, I'm going to go ahead and coil this up in with my finger just to make it a little bit easier to go in, a little bit more flexible. And I'm going to go ahead and lubricate the tip of my tube with a water-soluble lubricant, and I'm going to lubricate it about 4 inches. Okay, so I'm going to go ahead and have my patient take some sips of water, and then I'm going to set this next to him because I'm going to have him take some sips here in a little bit as well. So I'm going to go ahead and have him lean his head back. I'm going to have him take a deep breath, and I'm going to insert the tube towards the opposite nair. And I want to, before I do this, make sure I tell him that if he needs anything, if he needs me to stop or at any point during the procedure, I'm going to have him put his hand up just so I know to stop. So I'm going to go ahead and insert this with his head back towards the opposite nair. I'm going to turn it 180 degrees, and I'm going to go in past the nasopharynx. And then I'm going to have him, once I get to the oropharynx, I'm going to have him take a few sips. And I'm going to have him tilt his head forward and go in the rest of the way. And for the sake of this video, the mannequins don't let us go down super far, so I will just say that it is at my tape spot, which is 47, just for the sake of the video. And so I'm going to go ahead and secure this so that I can check for placement just temporarily. And I'm going to check inside the mouth, make sure it's not coiled up in there. Perfect, and it's not. So I'm going to go ahead and I'm going to aspirate. Make sure this stays. Aspirate for contents. I'm going to clamp it whenever I'm not. When I take it out, and I'm going to put it on my pH strip, and then I'm going to fill this up, and I'm going to check for placement with air. And then the third one is also to get an x-ray done to see if it's placed, but for now we're just going to do the aspiration in air. So I'm going to go ahead and get this over the xiphoid process right there, and I'm going to insert 10 to 30 milliliters of air, and I should hear a whooshing sound. Okay, perfect. And if I didn't, I would want to go 2 more inches and check again. So now I'm going to go ahead and clamp this. And if my patient had super bad coughing or turned blue while inserting the tube, I'd want to go ahead and make sure to immediately take that out and try maybe lubricating again, possibly going in the other nair. So now I'm going to go ahead and secure it to the nose. I'm going to go ahead and take this and tape it to the bridge of his nose. I would want to make sure if the nose is oily or anything that I cleaned it off beforehand so that it would stick to the tape fine. And then I'm going to wrap this up securely around the tube so that it does not come out, keeping the edges folded. Okay, so I'm going to go ahead and secure it to the gown. With a clothespin or rubber band, whatever your policy says. So I want to make sure I leave some slack there. Okay. And I have them take maybe a few more drinks. And then I would make sure to clean up my station. I want to check my pH contents. I want to do whatever my policy says, whether it's hooking up to suction or feeding or clamping it. And I'm going to go ahead and put him in a good position. Lower him back down. I want to keep the bed elevated at least 30 degrees if he's got a feeding, especially. Do hand hygiene. I want to check my pH strip to see compared to here. So you want it to be below, I believe, 0 to 4. So it is, which is good. And then I would go and document the placement of the tube, how my patient tolerated it, and what my pH content was whenever I aspirated.